So now I'm doing my pre-op assessment in my head to toe for my patient to go down to surgery. So I'm gonna go in, I'm gonna perform my Kiwis. I've introduced myself to the patient and I've identified the patient using his arm bracelet and my doctor's orders and my MAR, which I have right here. Okay, so I know that this is Mr. Jamie Carson. He's an 18-year-old male, and I'm gonna match his birth date to his arm bracelet. And because my patient's young, he's able to verbalize to me as well. So I'm gonna be being both people, okay? So my patient was able to verbalize to me his name, his date of birth. He was able to tell me who the president was, where he is, and the date. So I know he's alert and oriented ×4. First and foremost, I'm gonna let him know that I'm here to perform an assessment on him. I'm gonna wash my hands and put on my gloves. As I'm doing these things, I can also be talking to my patient and asking him, I can assess if he has any pain. My patient states to me that his pain is a level 9 right now, and that he's in pain. During my assessment, I'm going to be assessing his orientation to see if he's showing any signs of distress, if he shows any signs of respiratory distress or anything of that nature. I'm also going to be taking note of his skin. As I'm doing his assessment, as I move from head to toe, I'm assessing his skin using my ABCs and my OPQRST to see if he has any moles, lesions, or anything of that nature. So starting from his head, I'm just going to go ahead and palpate his scalp, checking his hair. His scalp feels normal. His hair is full and thick and brown. It's of normal limits to my patient's age. Now I'm going to move on down to his, I can go ahead and check his ears. Oops, I don't have my pen light on me. I left my pen light in my room. But I would check his ears. I'm looking for any drainage. There's no drainage in either of his ears. So I'm gonna move on to his eyes. At this point, I would have used my pen light that I can run in. I'm actually just gonna go and run and grab it. Okay, so I'm gonna use my pen light and I'm gonna be checking the constriction of his eyes. So I'm gonna go ahead and flash my pen light. And I should note that his eyes constrict and dilate with the light. So I'm gonna go ahead and do it to the back, to the other side. And it does. I can also just bring my pen towards his nose to see if his eyes converge. There's no drainage coming from his eyes. His eyes are brown and they are white. The area is white, the sclera is white. So now we're gonna move on down to his nose. I can go ahead and look in his nose to see if there's any drainage. There is not, okay? So then I'm gonna go on down. I can palpate his lymph nodes. Lymph nodes feel normal. Okay, perfect. Now when I go ahead, I can assess his lung sounds and his cardiac sounds. I've also got my board here so that I can show exactly where I'm gonna be auscultating and listening to the lung sounds. So I can go ahead and listen to the lung sounds. And again, as I'm moving down, I'm gonna be assessing his skin. I'm gonna take this down so you can see a little bit better. Okay, so with the lung sounds, when I'm listening to lung sounds, I can go from left to right and then down, then back. Okay, so I'm gonna go ahead and start here. His lung sounds normal. And again, I am still assessing his skin. His chest is symmetrical. I could have also performed, I'm gonna actually leave this off, perform some vital signs prior to, which I have taken already. His chest is symmetrical. His lung sound normal. There's no crackling, no wheezing. I can also check posteriorly, but I'm going to do that all together at one time. Right here, right now, I'm also going to go ahead and do his cardiac, his heart sounds, so I can listen to the beats of his heart. I'm going to go ahead and start at the aortic. Then I can go ahead and move over to the pulmonic. I'm going to go down to herbs, tricuspid, and over on this side is mitral, where I would listen to his heart sounds. Okay, those are normal as well. So now I'm going to move on to his abdominal assessment, and I can also assess for cranial nerves. I can have my patient smile, puff up his cheeks to assess his cranial nerves, his facial cranial nerves, the abducens. I've done the eye movements. I could have used like alcohol and had my patient smell alcohol to assess his smell. And then once I've assessed all of his cranial nerves, I could note whether or not they were all intact. And after doing that, all of my patient's cranial nerves are intact. So I'm going to move on down to the abdominal assessment, and I'm just going to lay him down now. And I'm still going to be assessing his skin. So now that I'm at his abdominal assessment, I know I'm going to auscultate before I palpate. So I'm just going to inspect it right now. I'm inspecting it. His abdomen is a little bit distended, hence him going down to get the appendectomy because he's got an inflamed appendix and he's got some appendicitis. So I'm going to go ahead and auscultate, and I'm going to start in the right lower quadrant. And I would listen for 1 minute, but if I did not hear any bowel sounds, I listened to up to 5 minutes. I'm gonna go up here. Okay, so after listening to my bowel sounds, I do hear bowel sounds. Bowel sounds are active, so now I can move on. I'm gonna go ahead and sit him back up. And I went to the abdominal assessment, but I'm gonna go ahead and assess the hand grasp. And he's strong bilaterally on both sides. I can go ahead and do my capillary refill on the fingers. And it's less than 3 seconds, which is great. I'm checking for any edema of his extremities. I'm also going to be noting the skin. His skin is moist and brown. It's within normal limits of his race and skin color. There's no lesions, there's no moles, there's no bruising or scarring on my patient's arms. I'm just gonna note that he has a little tattoo on his left arm. Okay, so now that I've done the abdominal, I'm gonna move on down to his legs, assessing for any edema. There's no edema here. I can go ahead and also do some pedal pushes with his legs just to assess the strength, and I can also do capillary refills on here. Okay, and then I'm going. I'm also still assessing the skin on my patient's legs. There's no edema, there's no moles, there's no lesions, no lymphedema, nothing of that nature. He's a normal, healthy 18-year-old. He's just having problems with his appendix. I can also go ahead and do a genital assessment, assess my patient's genitals. Things normal. There's no drainage, no scarring, no bumps or anything. Everything looks normal down there. Then we're going to go to the posterior side. So I'm going to go ahead and turn him around. And this is where I can also assess his lung sounds on his back. There's 10 places here, so I can go ahead and do that once again. Oops. Uh-oh. Okay, perfect. And lung sounds are normal. So we can go ahead and cover him back up. I would take a look at his buttocks. That's normal. There's no skin breakdown, nothing there. So we can turn back. I can also use during this assessment, I can do a radial pulse or a brachial pulse. There's pulses, pedal pulses, they're back in here. There's also pulses behind the knees, the popliteal pulses, and the dorsalis pedis pulses that are in between the toes. And then there's the brachial, the carotid pulse that's here, and then the temporal that's in the head. And that's it for my head to toe. Thank you.